Hi everyone, my name is Monica. Today I'm going to discuss the Unit 7 journal assignment. Before I jump into the analysis and question, the brief topic I want to mention is that this is a topic about cultural competency. Before I jump into the specific question, I want to quickly define the cultural competency. Cultural competency refers to the ability to interact effectively with the people from diverse background, culture, and belief. It involves recognizing one's own cultural biases and developing the skill to communicate respectfully and appropriately with others, even when their beliefs and practice differ from one's own. Um, the key component of cultural competency I want to mention over here is awareness, knowledge, and skills. If I have to briefly describe the awareness, it is involving recognizing one's own cultural biases and perspective and how they might influence interaction with others. In knowledge, and knowledge, this involves gaining information about different culture, including their value, beliefs, and practice. And another component or component of the key component of cultural competency is skill. This involves developing the ability to communicate effectively and empathetically with the individuals from different cultural background. So back into the our evaluation question, back into our question according to the rubrics. Describe an instance where you lack cultural competency in a specific situation as a nurse. So I want to remind my earliest day of practice when I just started nursing. That time I encountered one of the patient in long-term care. He was a long-term rehab patient, and he was Muslim. It was kind of this one. It was kind of February time, and one specific incident happened is in February there is a Ramadan in Muslim community which I was not aware. And I was not being disrespectful in purpose, but I was not aware of cultural norms in Ramadan. What is the eating pattern and how the fast goes, how ritualistically they follow the culture, and how it impact their worldview and cognition and overall perspective of culture itself and ethnicity and ethical belief system itself. So that incident, I offered the AM medication to my patient. It was a first encounter with him, and I told him, "Please take your medicine, Mr. Khan." And Mr. Khan was like, "No, I can't take the medicine." And one thing I personally think first time when I interacting is, why he's refusing medication? What should I do? And I went back and talked to the charge nurse, and in charge nurse was like, "Okay, let's go and talk one more time, see what's the reason." And he was not very fluent in English, so I was having hard time to understand a lot of stuff. And when we entered the room, his son was there, and we have a small conversation like why he's not willing to have medication, what's the reason behind it. And he briefly discussed why, because what is the belief system of them regarding Ramadan, what is the practice. And that was eye-opening. I get to know that when sun is already up, when bright sun is already up, they can't have food until sundown. They need to fast without even a water. And I offer that medication at 7 a.m., which was already bright sunny, and which is not culturally accepted and culturally appropriate. So I apologize, and from next shift we started offering him a medicine before sunrise. Even night shift, before they leave, about 5:30 they go and offer him medicine and he take it. They call it iftar, which is very cute. I really like that. Okay, how did you handle the situation and to ensure they provide the best care possible? Yeah, as I mentioned, I use the skill of cultural awareness, and I get the knowledge from the conversation, and I change my attitude according to his acceptance level, and I build a skill to communicate, at the same time approach in a way that is culturally sensitive. That's how the problem was resolved. What did you do to correct your deficiency of cultural competency in the specific area to improve your nursing skill and knowledge for future patient and client? As I mentioned before, for the competency of for the competency of cultural for competency of cultural competence, we need a 4 component, that is awareness, attitude, skill, and knowledge. In the awareness part, as I mentioned, awareness of one's cultural worldview. I change my worldview according to the cultural need, and I educate myself to empower in bring awareness and knowledge of different cultural practices and worldview. Yeah, and I also see in the perspective and the lens of patients, so I have better grasp of understanding of culture. In attitude, I change my attitude toward the learning and listening, and be more generous and open-minded, so I can accept and take care of the patient as a unique individual rather than my own personal bias interfering in it. And I also developed the skill of cross-cultural communications, which empower my skill as a nurse, and it's gonna empower my it is empowering my skill as FNP or now, and it's going to empower my skill in future as a PHNP BC as well. As a PHNP, how will you ensure you continuously learn and improve in the area of cultural competency to be the best provider possible for all the client? So yeah, for that as well, I want to mention I will empower my knowledge, the background of the culture. I will change my attitude, feeling as if know everything. There is no. I will willingness to learn, listen, and cultivate a positive attitude towards diversity. And I will educate myself to be culturally competent and culturally humility. So that's about it. Thank you so much for your time. I really appreciate you, and you have a blessed day. Thank you. Bye bye.